Hello everyone, I am Dr. Arunima Srilata, Associate Professor, Bharati Vidyapeeth College of Nursing, Navi Mumbai. Today we are going to see about qualitative research design. Before moving into the topics, so we'll see what is research approach or what is research design. If you think of building a house, the first thing is you try to purchase a land. So when you plan to purchase a land, you may speak to a broker for purchasing a land, or you'll try to search it in Google to get the land, or a newspaper advertisement, or different approaches, different way to identify the land which you try to build the house. So the way of doing a research problem, way of exploring a research problem, there are different technique, different way to do it is research approaches. So once you purchase the land, you have a plan, overall plan of how to construct a house, a single story house, or a double storied house. Where should be your kitchen? Where my should I place my bedroom, wardrobe? So you have a detailed plan of building it. You have a blueprint of it. So the blueprint of ideally what you are doing to perform a study, a research problem is design. The way of identifying the research methodology, that is approach, and the ideal blueprint or a plan, ideally how you are performing the study is research design. So the overall plan to answer a research question, how we are going to do it, that is the research approach. A framework, how ideally you are going to research is carried out, how you are exploring the research is research design. The two approaches which mainly which we perform is quantitative study and qualitative study. As you know, quantitative means in numericals, you have a numericals exact number, very specific number. Qualitative studies will have attributes more than numericals, it has attributes. So this is the branch, the classification of research approaches. You can see the research approach, the main is quantitative and qualitative. There are some other approaches like formative, operational, methodological, meta-analysis, evaluation, and outcome research. But today in this lecture, we are focusing on the qualitative designs. The main qualitative design which we are going to discuss one by one is phenomenological study, grounded theory, ethnographic study, historical study, action research, and case study. So in further slides, we'll be seeing one by one with the suitable examples. Okay, so first is qualitative research. The qualitative research. What is qualitative research? Is we does qualitative research to understand about a research problem or a topic in a very deep way. We understand the perspective of that particular problem. We obtain the culturally what specific information we can take is we take it through qualitative study. It can be a lived experience, it can be a perspective of a particular person or a participant or a sample or any context of a given situation. For example, those who have faced any natural disaster, man-made disaster, you ask their experience of how very specific, very peculiar, very particular experience. It's not a common thing, so you have experienced it in a special way. So what is your perspective on that particular thing? If you understand that perspective of a research problem from a participants in depth, the lived experience, the person which has experienced that particular scenario, if you get the information, that is a qualitative study. The first classification was phenomenological study. So the way of understanding about a particular phenomena, a particular understanding, again an understanding, a deep perspective. For example, the lived experience. So you during the time of flood, you have experienced the flood, you lost your family members, you lost everything, you lost house, you lost everything. So it was experienced by very few people, very few population. You go talk to them, what was it, how was the flood happened, after the flood what was your experience, what was your financial loss, what was your feeling on that time, in depth what they have faced, which nobody cannot explain, it can be explained only by them, about that particular phenomena, particular experience, that is phenomenological study. For example, you are conducting a study to obtain the physical, nutritional, sexual problems of patients with colostomy. A patient with colostomy, it's a common factor. You everyone have common physical problems, sexual problems, nutritional problems. But when you go for an in-depth interview to unmask their mind, they have very minute physical, sexual, and nutritional problems, which it's very unique for that person. So you are not asking a very normal routine questionnaire. You go for an in-depth interview to understand very minute, minute feelings of that person. So next comes the grounded theory. The second research design of a quantitative approach. So it's a systematic quantitative approach used to generate a theory, explains the conceptual level, a process, or substantiatively you are creating something is grounded theory. And it's a qualitative research design in which the researcher, that is the inquirer, generate an explanation of a process, action, or interaction shaped by a large number of view of participants. Developing a new theory on nursing, developing something new in a theoretical base, that is exactly what is grounded theory. So, for example, a study carried out to explore the and describe the nurse's perspective on factors of response to their burnout. You understand in depth from a large participants what are the reasons of burnout, how it is affecting your life, how it is affecting your personal and professional life. You understand, you get a very thorough background information to develop a stress implementation program. So you develop something out of your inputs. So that is grounded theory, and it is usually theoretical based. You are getting information from a large number of participants. The third one is ethnographic research. The ethnographic research, it is studying the culture. It's a study of a social interaction, behavior, perception of a group or a team or a communities. You are a very rich culture from transgender people. They understand the culture from a particular religion or from a particular country, a particular racial group. You are understanding something about their culture is ethnographic study. So ethnographic study of about nurses who are giving care for if international level. If you understand a patient, if you ask a patient how well, what is your how well you differentiate an Indian nurse, a Pakistani nurse, an American nurse when you are giving in terms of providing care. So that kind of culture related thing, information you are getting is ethnographic study. Next is historical, as the name indicates, examining the past, even what has happened in the past. You just go retrospectively and understand what was happened, what was their experience. So you collect the information which has already happened. For example, nature of nursing work in Victoria in 1940 or 1970. The second example, perception of first batch BSc students, that was in 2002, 2009. That was the first batch. There was no juniors, there was no seniors. What was your experience when you joined college? That was happened in 2009. So you go get the address from admission record, connect them through Facebook, WhatsApp, get their numbers. They may be in different parts of the country. You talk to them, what was your experience? So that digging the past, getting the information which was happened already in the past, that retrospectively you collect the data, that is historical research. Next is action research. Same. It aims to solve specific problems with a program, organization, or a community. Learning by doing. Action means you are doing something, contribute the practical concern of people. It is usually used in real situations and solutions to a particular problems more than studies. For example, changing the exam pattern in undergraduate nursing programs through a action research. You perform a study, students are repeatedly reduced, have a difficulty in facing exam. Their percentage is very less. So you identify there was a problem happened in the exam pattern or question paper pattern. So you try to implement something, do as action, learn it and do something, change it, and you make a change, you create a change. So that is action research. And the last is a case study. As we all nurses, we know we write patient case study. A single patient in depth you will write. In research, it will be more. So intensive, in-depth investigation of a single unit of a study. It can be a single person, a single family, or a community. You will record in-depth interviews, their medical records, you retrieve data, you concurrently, you retrospectively, or in prospectively, in future terms also, you will be understanding the information. So that is a case study. So for example, a case report on Maya disease, which is a very, very rare condition. So in this case, your person, a single person, you are performing the study. How old is she? What was her medical history? What was her birth history? What was her personal medical, surgical, obstetric, gynecology, dietary pattern, her physical parameters, or if she have any investigation records like X-ray, MRI reports. So whatever very minute information from that particular person, if you are be able to collect, you collect it. So that can be converted into a research paper as a case report. So that is a qualitative study. So we'll just brush uh, the 6 designs of qualitative study. First is phenomenological, so you understand the lived experience. The second one was grounded theory, so you develop the theory. Third was ethnographic, which is related to culture. And the fourth one is a historical study that related to past events. Then action research, you do something into practice. And the last was case study, which a single unit you performing a qualitative study is case study. So today's lecture we have just had a talk on qualitative study. Hope all of you have understood the topic. Thank you very much.